Good morning. We're here live at the annual meeting in San Diego with Dr. Alice Epitropoulos. Thanks a lot, Alice, for being with us this morning.
Thank you for having me.
Alice, I'd like to offer some congratulations. I understand that your paper had won Best of Section Award, so congratulations. I'd like to ask you a little bit more about it. It's about meibomian gland dysfunction and about thermal pulsed therapy. Can you explain for us a little bit of background about meibomian gland dysfunction, how it's become a really important topic for us to discuss, and what some of the evolution has been in terms of imaging and treatment?
Sure. This is the first paper that has actually indicated an increase in gland structure with treatment, with LipiFlow treatment compared to untreated controls. What we know about MGD is that chronic obstruction leads to loss of gland function, atrophy, and dropout. We also know that LipiFlow treatment is highly effective in improving gland function, but as far as what we know, we haven't noticed any increase in visible gland structure. That's never really been measured in the past. So we're excited about this study.
So let's talk a little bit more about the details of the study. Can you tell us about your population, how many people you studied, and what was the time frame through which you imaged the meibomian glands?
Yeah, so the current grading system of evaluating these glands are too broad to really measure small changes. So we've hypothesized that if we can look at gland structure in more detail, that we can potentially measure small changes over time with treatment. So we did a retrospective observational study looking at patients that had LipiFlow and to determine if there was an increase in gland structure. And what we found was that, I actually worked with a ophthalmology resident at University of Cincinnati, Dr. Hura, and he actually devised a method where we used Adobe Photoshop software, allowing us to look at gland structure in pixelated detail. Okay, so we could actually visualize the glands in much more detail than the current grading systems.
Okay.
So we found that 69% of eyes that underwent LipiFlow treatment had an increase in visible gland structure compared to baseline 1 year after treatment. This is in contrast to 71% of untreated controls that had an actual decline in visible gland structure after 1 year baseline.
Well, those are really impressive data, of course. I wanted to ask you a little bit more about the structure of the treatment versus the control group. Are these contralateral eye control versus treatment, or are these sort of age-matched patients in your cohort?
Yeah, so what we did was we looked at patients that had LipiFlow and compared it to patients that had MGD, where we recommended LipiFlow, but the patients elected not to proceed with therapy.
I understand. So that's I think a great way to match your cohort. Let's talk a little bit about how LipiFlow can sort of be an adjunct or one treatment among others in working with meibomian gland disease. Do you find that you often make combined therapies, such as with topical or systemic antibiotics or systemic omega-3 fatty acids? Do these work in synergy with something like LipiFlow?
Absolutely. We know that dry eye disease is multifactorial. So if we can combine thermal pulsation treatment with a combination of BluffX, lid scrubs using usually hypochlorous acid or tea tree oil, and omega-3, a high-quality omega-3, that really does help to increase our success rate with this type of treatment.
Let's talk a little bit about treatment paradigms for LipiFlow. And what I mean by that is there a time interval after which you think that a retreatment with LipiFlow is beneficial? And if so, what is that time interval, or is it vary from case to case?
I think that the more patients are compliant with their regimen after LipiFlow, the more success they're going to have with the treatment, and the longer that effect is going to last. Typically, LipiFlow, and this has been published in the medical literature, can last for a year or two, the benefits of that treatment. So again, I really encourage patients to remain compliant with their therapy.
Well, Alice, this has been such a wonderful discussion for us about meibomian gland dysfunction and how LipiFlow can really increase the amount or utility of meibomian glands. Congratulations on your award.
Thank you, and I want to add one more comment.
Yes,
I think that these findings from our study suggest that visible gland structure, just because you don't see the glands, doesn't necessarily mean that there's absolute atrophy or loss of function. It may indicate loss of activity that helps to improve after treatment, indicating gland reactivation.
That's a great point. I'm glad that you brought forth. Thank you so much, Alice, for being with us
Thank you
and
so
for
much.
discussing this very important topic this morning. Thanks again.
Jonathan.